Coming up on Pet Medics, it's dental day on the farm and in the clinic.
That tooth's going to have to come out.
Marcus has some teething problems on a local horse breeder's farm.
You know what you're doing, do you?
Nurse Nicola's magical miniatures.
No, stay away. I like a bit of attitude.
And what happened to the calf that was left for dead?
You won't recognise the Max.
I'll just have a look for you.
This picturesque place is home to the Tauranga Vets, the largest veterinary clinic in the area. The team of vets tirelessly care for the region's pets and working animals. No problem or furry friend is too big or too small. It's 6 a.m. and vet nurse Nicola has a lot to do before her working day begins. This country girl has always been mad about animals and has been surrounded by them since she was a kid.
I moved here when I was about 13 years old, so growing up with chickens, horses, cows, dogs, cats, you name it. I got my first pony given to me when I was 7.
And the pony bug has never left her.
When I first started vet nursing, time became quite pressed, and so I decided that these guys would be a little bit easier, but believe it or not, these guys I think take up more time than the big horses. And up. You can see his little attitude. This is him trying to put me back into place because he wants the grass. No, stay away from the car.
Luckily, his stablemate is a bit more relaxed.
This is Aoife. She's actually my mum's horse, so it's a bit of a family affair, family sport together for mum and I, which is really, really neat. These guys have literally been together since birth. We bought them together. They've been raised together, and so they are very, very good friends.
As a vet nurse, Nicola is used to working inside the clinic. But today, she's out with mixed animal vet Marcus on an equine adventure. Marcus has been with the Tauranga Vets for over 5 years now, and today he's working with an equine dentist, sedating the horses while she operates.
Today we're at Carol's place. We're going to rasp a bunch of her horse's teeth. They're just routine dentals.
Being out and about, out on the farm is excellent. I'm always in the clinic, so my passion is horses. As everyone knows, I'm horse mad, so it's fantastic to be out on the farm.
Owner Carol's horse farm is the realisation of a lifelong dream.
When I was 8 years old, I wanted to have a farm and breed horses. And it took me 40 years, but that's what I'm doing now.
A crippling accident a few years ago took away Carol's ability to read, write and talk.
About 9 months after the accident, I started practicing talking out loud to
the
them.
horses.
Yeah.
Wow.
And got my talk back.
Carol's accident gave her a deep understanding of horses, and today she runs a successful business being with the animals she loves.
I breed Welsh and Welsh cross ponies. When they're a year old, they get their wolf teeth taken out, and so we're doing that with 2 of them today.
Despite her in-depth knowledge of horses, removing teeth is a first for Nicola.
I've never actually experienced or seen them being removed, which I'm pretty excited to see.
But it's no easy job. Wolf teeth can cause discomfort and pain, as equine dentist Anne-Marie explains.
Wolf teeth are kind of like wisdom teeth in people, so some horses will get 4, 2 in the top, 2 in the bottom, some will get none at all. The biggest problem with wolf teeth is they sit where we put the bit, which is obviously a challenge for comfort for the horse and to get them to accept, nice contact.
Yes, a higher gate.
Doing dentistry on horses is not easy, and Anne-Marie knows to expect the unexpected.
You never really know what you're getting or, what the horses are like, which is probably the biggest challenge.
And with 2 horses to treat, Nicola and the team have a very busy day ahead of them. Meanwhile, at the city clinic, there's a visit from one of the vet's most regular clients, Geraldine Hunter.
Hi Geraldine, how are you going?
A local farmer with a menagerie of creatures. Her kind heart sees her go the extra mile for her animals. Even local strays become pets. This morning, she's brought her elderly cat, Grayleen, to see Holly.
She screams very loudly when she meows because she's deaf. And she spent the whole of Easter running around screaming at us, and then she spent the next couple of days sleeping, so I'm a bit concerned that there's something going on.
Grayleen's erratic behaviour has Geraldine worried.
She is 11 years old, and you've got to expect things as they get older.
Yes, come on. So what exactly has been going on with her, Geraldine?
She's isolated herself from the others. Like, she used to always sleep with the other two, and she sleeps in odd, funny places. At the moment, she's sleeping in the computer room on an old modem.
Holly immediately notices a trouble spot, Grayleen's teeth.
You got one very bad one though, Geraldine. Does she often have quite, I guess, raspy breathing?
Yes, you can always hear her.
Grayleen seems to be gasping for breath, and Holly is very concerned.
She sounded like that for quite a long time.
Yeah.
We'll just have a good listen to her heart and lungs.
Grayleen's an old lady and takes offence at Holly's poking and prodding.
Okay, we'll just... Oh!
No.
Oh!
Yes, I know.
She's a bit of a character, isn't she?
She's actually Terry's cat. He thinks she's just wonderful, and she...
But Grayleen thinks the clinic is anything but wonderful and makes a jump for freedom.
Oh, God. Just relax, just relax. Okay.
She's a feisty old dame now, but Grayleen started life as a shy stray born in a piggery until Geraldine took her in.
She was a tiny little wee thing when she was born. She was really sick. I didn't ever expect that she'd survive, and she did survive. And she gradually moved herself down to the cow shed and then down to the house. She's just been a house pet ever since then.
Then it probably means...
The rough life of a stray has far-reaching health implications, as Holly explains.
They'll often have got cat flu when they've been really young, and then that's something that as you get older, your immune system, everything's not as good.
Holly wants to extract the rotten tooth, but needs to make sure Grayleen's battered system can handle the anaesthetic, let alone the trauma of the extraction.
We should do a blood test on her and see, basically check her kidneys, check her thyroid. I think I'd definitely be doing that before I said, yep, let's knock her out and take out that tooth.
But Grayleen's not going to make it easy for her.
Okay, little lady, I'll get you on the towel. Probably a little bit challenging to get blood off, but we'll give it a go. Geraldine, I might just get you to come over here and just tap on top of her head just while I do it.
Even this simple procedure is potentially dangerous for a cat in Grayleen's state.
That's it, all done. Here we go, good girl. Obviously, if the bloods are clear, we know that her kidneys are okay, then she'd still be a reasonable anaesthetic candidate, and then we would be able to sort that tooth out.
Geraldine is taking Grayleen back home to the farm as they await results.
Lovely, thanks, Geraldine.
All right, thank you.
Hopefully she's fit enough to have the surgery she so desperately needs.
Yeah, we can do that.
Coming up, a horse with the wobbles throws the surgery into doubt.
She's struggling in her back end a lot.
Got the wobble on?
Yeah.
And Max heads to the country, checking up on Grayleen and a wee calf he last saw at death's door.
Oh, there she is.
The Tauranga vets cater to an urban and rural community. The vets are often out and about caring for the local animals. Cat Grayleen's blood tests are back, and she's well enough to have surgery. Max has offered to pick her up from the farm of vet regulars so he can also check up on a former patient.
Just heading out to have a look at that calf that we did that blood transfusion on and just sort of see how she's doing. How's it going, Terry? Geraldine?
G'day, Max. How are you today?
Not that long ago, Terry and Geraldine's calf was at death's door, and new vet Max attempted his first blood transfusion. It was a nerve-wracking procedure. At first, he wasn't sure if the calf was going to make it.
In the immediate sort of few hours after the transfusion, we can get reactions to the blood, and there was a potential that that was happening. Yeah, good. Beautiful day for it.
The calf had been bitten by a tick and had developed a blood disease. Only a transfusion could save her.
You won't recognise the Max.
Oh, there she is.
What do you think of that, Max?
Beautiful, strong girl.
She said it looks a lot better than she did when she was really ill, didn't she?
Really put on a lot of condition as well.
2 weeks ago, this calf was fighting for its life, so she's a satisfying sight for Max.
Other cockies would have probably shot her, but
Yep.
but not us. Well, not Geraldine anyway.
The calf looks great, but seems to have recognised Max.
Stepping away.
After what you did to me, I'm not quite sure of you, Max.
With the calf well on its way to full health, Max picks up Grayleen the cat.
We call her Grayleen because when she was a little feral kitten, she was grey and very lean. So Geraldine called her Grayleen.
Terry's beloved cat has been given the OK to remove her rotten tooth, so Max can take her back to the clinic with him.
See you guys later.
Max's work here is done, but on a nearby farm for the Tauranga vets, it's only just beginning. The vet team are at Carol's horse farm to do a dental makeover on 2 of her horses. Equine dentist Anne-Marie is removing some of their wolf teeth.
The wolf tooth on the left side is blind, so sitting underneath the gum.
Okay, yeah, so she will need more sedation because you'll have to cut the gum.
Absolutely, yeah.
And there's a further complication.
Rather than the tooth having pushed out through the gum, it's pushing forward into bone, so it's a little bit of an unknown quantity.
Equine dentists are not allowed to administer medication, so vet Marcus is on hand to do so, assisted by nurse Nicola. He's already given Victory 1 dose, and now Anne-Marie thinks she might need a top-up.
Excellent.
Too little, and the horse will feel the operation. Too much, and it may fall over.
So she's got to have a real good level of sedation now. It may get wobbly, shouldn't go down.
Meanwhile, Victory's sister Happy comes in for a closer look.
What are we doing to your little sister? Well, these two are very good friends as well as being sisters.
What are the chances of that, eh? Sisters being friends.
Dad jokes aside, Anne-Marie is ready to begin.
We're just popping the speculum on. You can see it sitting in between the 2 front teeth here. And basically this allows us to open the mouth and to visualise what we're going to be working on.
Feeding her the turmeric.
And just as Anne-Marie begins the procedure, Victory starts to move. It seems she may require even more medication.
Need a little tiny top-up, possibly. Just a little bit too on planet Earth.
Anne-Marie is working dangerously close to a large artery. Marcus must sedate the horse perfectly, enough to keep her still, but not so much that she falls over.
Because we're using, sharp objects and scalpel blades near an artery, we don't want a horse that's flailing its head around while we're trying to extract teeth.
Nicola notices that the horse is unsteady.
She's struggling in her back end a lot. She's going down on
Got
that
the
one
wobble on?
foot. Yeah.
Victory still might feel what's going on, but Marcus cannot risk more sedation in case she collapses. He decides to administer a local anaesthetic, which will numb the area without making her any sleepier.
Some horses take a lot less sedation than other breeds, and there's other breeds like Kaimanawas take a lot more than normal.
Nicola's years of experience with horses is also coming into play.
I'm just grabbing a little pinch of skin on the neck here just to create a little bit of a distraction for her, just to kind of take the focus off what's actually happening up the front.
It's not as big as them, sisters.
Oh, good.
There we go, it's like giving birth to a baby.
It's out, and its size is surprising.
So that's the culprit.
Oh, it's tiny.
Wow, it is tiny.
Yeah, so you can imagine how tricky they are to work with.
Anne-Marie rasps the horse's teeth to smooth them out, and Nicola takes the chance to learn from the expert.
Do you want to have a feel of what it's like now it's done?
Yeah, I'd love to.
You feel now against the cheeks how they're nice and smooth and rounded?
Yeah, no hooks, no sharps.
Exactly. Right, little one, you can have your jaw back.
As Marcus takes on the next horse, back at the city clinic, Max has brought Grayleen in from the farm to have her teeth done. Her blood tests have come back clear, and vet Kate prepares for surgery.
According to the owners, things have improved since their antibiotic course, so fingers crossed that there are no other sort of significant issues that could compromise her under the anaesthetic.
An animal's oral health is a vital part of their welfare, well beyond the pain of a sore tooth.
Dental disease can cause a multitude of other health issues that go with that. Aside from the pain and discomfort it can cause for the animal, it can also affect their general health and overall well-being.
While Grayleen seems happy to receive a bit of attention, Kate is not looking forward to the operation.
Dentals are one of those things that very much test my patience. It's not what I'd consider one of my favourite jobs as a vet.
But for Grayleen, it's even less fun. Despite a clean blood test result, her breathing is still causing concern.
I think it is it's noisier when you listen to her throat than it is to her lungs.
As Kate begins the operation, she sees just how bad Grayleen's dental situation has become.
Oh, she's got barely any teeth.
Kate is now fighting to save any teeth at all.
There's a hole or a bit of tooth eroded there, so that tooth's going to have to come out.
Coming up, does Grayleen lose the lot?
They're both coming out.
Yeah. And why has Marcus been left holding the scalpel? At the Tauranga Vet Clinic, Vet Kate is operating on beloved farm moggy Grayleen. She was hoping to leave her with at least one tooth.
In order to get these teeth out, we're going to cut them in half. It splits the tooth into individual roots, which makes it a lot easier for us to get them out.
I'm 3.
As Kate works away, nurse vet Jess comes to support her.
It's one half of one tooth. 4 to go.
Whoa, how brilliant. Dentals can sometimes take quite a while, and sometimes our vets need a little bit of encouragement to get to the end. Woo! Let's go, Kate. Tooth out.
Another cheerleader arrives as Holly comes in to check up on her patient.
How's Grayleen getting on?
She's all right. She's got 2 little teeth hidden under here, under that rotten tartar there.
Need to come out.
They're both coming out.
Yeah.
Oh, this one's bloody hard though.
Kate is still very worried about Grayleen's raspy breath and consults with Holly.
When you listen with a stethoscope, it's noisier when you listen here than when you listen down there.
But just when she thinks she's in for the long haul, she strikes gold.
Got it. That came out quite nicely, and we just cleaned it up there, so we're going to turn her over and have a look at the other side.
The news is not good for gummy Grayleen.
So on this side, she's only got 1 tooth, which is very wiggly and will also be coming out. Sorry, Kate.
The operation is over, but Kate's been unable to save any of Grayleen's teeth.
Grayleen's had some big dental surgery today, so she's had 3 teeth in total removed. What happens is sometimes when they've got really rotten teeth like that, the bacteria can shed off into the blood and spread around the body in that way and cause little infections elsewhere. She'll be a lot better off without those teeth now.
It's soft food from now on for Grayleen, and a rest. She's earned it. Kate can hang up her dental drill for the day. Meanwhile, in rural Tauranga, Anne-Marie is on to her last patient. This pocket pony is next in line for his wolf teeth extraction.
Come on, little boy.
Marcus gets ready for his turn to remove the wolf teeth.
I don't actually know why they're called wolf teeth.
If you go back far enough in history, actually horses were once carnivores, and they used those teeth to hunt.
Oh, Marcus.
Enough horsing around, Marcus. It's time to take on a challenge.
Do you mind if Marcus elevates this one?
I'm good, Carol.
You know what you're doing, do you?
Yeah. I am just taking out the other wolf tooth. Me and Anne-Marie have done a few together, and it's just good to just have a turn.
Marcus has spent quite a bit of time with me learning about dentistry and doing a few wolf teeth extractions.
But dental is not his specialist area, and now Marcus is getting cold feet.
You can't quit.
Oh, no, I just don't want to muck around.
You'll be right.
Is it another really big one?
They're just in an awkward spot.
Marcus struggles with a tricky tooth.
It's probably easier to grab it from like front and back rather than the side because it's right snug against that tooth. And then you can pull straight down because the roots on the other one was straight.
Gosh, it's so big, isn't it, for such a little pony?
Decent one, yeah.
Success.
That's the wrong tooth.
And now it seems Marcus and his dad jokes are finally done.
Legit.
Yeah, beauty.
Job done. Wolf tooth out. Anne-Marie's here to make sure we do it properly. She's a bloody good dentist, so yeah, it's rewarding, satisfying to pull it out.
There we go, little fella, all done.
And with that, dental day is over. Next time on Pet Medics,
Good morning.
it's the weekend, but that doesn't mean a rest for the vets.
You just never know what can happen on a Saturday.
The tables are turned on a hunting dog who's been gored by a pig and left fighting for his life.
He's just not able to really stand up at the moment.
He's lost heaps of blood, and I think he's gone into a bit of a shock.
Just how many puppies will this pregnant dog have?
Yeah. I think she's very close.
And Holly goes from down on the farm to getting down.